The problem is you do see a lot of antisocial people succeed. Loneliness is as big a risk factor for ill health and death.
We live inside our heads.
You go cold turkey, you go into withdrawal.
There is a lot of value in the stuff that we struggle with.
Better Thinking. Conversations with experts exploring all things psychology. Welcome back to Better Thinking. My name's Nesh Nikolic, and today I have the privilege of speaking with Dr Amy Peden, an international leader in drowning prevention research and advocacy. Dr Peden's vision is to conduct meaningful research which amplifies attention on global drowning burden, identifies risk factors for drowning, and promotes safe use of all aquatic locations. She has a strong focus on improving data collection methods and approaches to ensure global estimates of fatal and non-fatal drowning are accurate and inclusive of an entire population. Dr Peden is passionate about translating research into action, including through public education and awareness and policy change. This passion clearly comes through in my conversation with Dr. Peden. I can genuinely say I was blown away with the data, insight, and value that she brings to this topic, and I'm thrilled to share her insights with you. So let's jump straight in. Amy, a big thank you for coming onto the program today.
You're welcome.
Really interested to talk about your work in injury prevention as a researcher, and in particular, obviously, your focal point on drownings. But I do have to ask, it's such a niche, it's such a unique space. How is it that you got into this space that I know you've been covering for quite some time now?
Yeah, I mean, I guess to a lot of people it might seem niche. I don't know, there's quite a passionate cohort of people working on this around the world, many of whom I now call my friends. So yeah, maybe we are niche. I've never really thought about it like that. I guess when it's your passion, you kind of don't really think it's niche. It's kind of all-consuming for you. But yeah, my path was maybe non-traditional, particularly because I've ended up as an academic in this space. I grew up in a very small country town in the middle of New South Wales called Parkes. Any Australian and maybe a few international listeners may know that it's the home of the radio telescope that beamed the moon landing to the world out in my friend's sheep paddock, and also randomly has an Elvis festival once a year. Really don't know why. But anyway, I grew up in a small country town, 10,000 people, 4.5 hours inland from the coast. Was very fortunate to learn how to swim, kind of fell into a role while I was at university studying public policy, fell into a role with Royal Lifesaving Society Australia. And that was the first time where I realised, I guess, that drowning was an issue. This would be back in around 2007. First time I realised that drowning was an issue, that not everyone had the privilege like I did of learning how to swim. And over time and working with the data and producing research and reports with that organisation, I came to see that river drownings were the leading location, or rivers were the leading location for drowning in Australia consistently for, 20 years. And everyone was talking about the beach. The politicians, the media, the funding, everything was focused on the beach. And having grown up in the country, so far from the coast, it really confused me as to why it wasn't getting much attention. So having finished my master's degree, I moved into a PhD while I was still working at Royal Lifesaving, really focused on rivers. And that has kind of really spurred me on, I guess, to work in this area of drowning prevention, because it's such a preventable issue that often gets neglected. And it's such a joy and a privilege to be able to enjoy the water safely that I think everyone should be able to have. And so, yeah, once I was faced with this issue and learned more about it, I really got hooked, and it's been my career ever since.
How have you reconciled this space, if you don't mind me asking, about all the attention being on beaches? Because me being completely naive coming into this conversation, that's where my mind went as well. Yes, there and residential pools is probably where my mind goes. But completely blown away by river drownings. Makes a lot of sense now, but a lot of things do once it's said, and with authority and backed with research. But how have you reconciled that, where all the focus, layperson like myself, is on beaches in particular?
Yeah, it used to frustrate me, and I would really kind of think, how can nobody else see this? I mean, it gave me a great avenue to kind of pursue and really make a difference because not a lot of work had been done in that space. But, particularly in a country like Australia, it's just a function of our culture. I guess we've had a very strong culture of life saving and surf life saving in this country. And, many of our politicians are quite well connected to that movement as well, the surf life saving movement. So it's just very powerful, and has always been very prominent. Some of the work I did subsequently down the track to kind of try and understand why we might be talking more about the beach or even pools, as you say, than rivers, has shown that a lot of these incidents occur in regional locations. We don't see them on the media. We don't hear about them. So until we start talking about it and encourage journalists to cover the issue, people don't hear about it. And really, it just kind of stayed that way for a long time. So partly it was just getting the word out and encouraging the community to think about it, the media to report on it more. And as we've done that and kind of highlight the issue, politicians are now more expansive when they give their warnings. It's not all about the beach, which I think is a really important outcome that we've achieved. But yeah, I think it's just a function of the history of the country, and maybe our beach drownings and our beach prevention approaches, which, don't get me wrong, we need to prevent drowning in all locations. They're just much more visible and more prominent to the community than rivers had been before we started this work.
And it's so important that the correct messaging is out there, because if we're not alerted to the dangers, we're likely to take potentially greater risks. As where when we go to the beach, it's something that we've just been told so many times. Look out for rips. Swim between the flags. All the good things that we do, but we just don't get that, and it's just, I suppose, raised a memory for me. I live in Canberra, and there's been so many times where a river drowning nearby, which is Cotter River for us, has occurred, and often with what I have understood, obviously purely only reading from the TV reports, but by competent swimmers, like 40-something-year-old man going out and, at least in theory, competent. I don't know, maybe they couldn't swim, or they were going in to help someone, and so on. But having that messaging is so important, to say rivers, or any body of water, but in particular rivers, account for the largest number, as you say. Maybe I should ask, what are the dangers? How is it that rivers are more or account for so many in comparison?
Yeah, I mean, it kind of goes hand in hand with this greater awareness about the coast, for a number of years, is that some of the hazards are easier to see, although, we can talk about how hard it is to spot a rip, and that a lot of people think they can, but they actually can't. But, we can see a lot of the hazards in these environments. We have a known prevention approach, which is the flags and patrolled areas and swimming between them, recognizing again that not all beaches are patrolled. We have really strong kind of messaging and interventions that we can lean on in that environment, which we just didn't have for rivers before we really started looking into it. So it's definitely a harder thing to answer when people say, what can I do at a river? Because it's not as simple as the beach. But for rivers, some of my work has shown, obviously with climate change, we're seeing very hot weather and people wanting to cool off in locations that, if they're inland, they don't have that coastal opportunity. So they're going to these waterways. With flooding, you have and drought and flood, the river will change. It can change course. It can change how much water is flowing through, the debris in it, the currents, all that kind of thing can change. One of the most compelling findings in my work, though, was alcohol. So a lot of our beaches are designated alcohol-free zones, and you can argue that maybe that's not enforced as well as it should be, but the amount of alcohol that is being consumed around the river prior to people drowning in these locations is hard to fathom. 4 times the upper legal limit for driving a motor vehicle. So there's a lot of alcohol being consumed in these locations. They're locations that people don't necessarily see the hazards because they're below the water, don't necessarily show it the respect that it deserves. And then in some locations, they can be very isolated. So some distance from medical assistance and good quality medical assistance if you're really in a bad way, and even just no bystanders around to help rescue you should something go wrong. So there's just a few intersecting risk factors, I guess, that can kind of contribute to why rivers are such a prominent location for drowning in this country and globally as well.
Mm. So alcohol is quite a primary factor, often involved when both drowning and I suppose not, I'm not sure what the right terminology is, but when possible drowning occurs, but it doesn't, they're saved by a bystander or whatever it might be. Alcohol's are a factor in those scenarios.
Yeah, so it's one of the key risk factors for drowning. A number of injuries, anyway. We talk about the road, falls, violence. It's a risk factor for a lot of different injury types, but very strong for drowning and very strong for rivers in particular. But yes, I guess, like I said, there's less enforcement in these locations compared to our beaches. We're a nation of heavy drinkers, unfortunately, and we love to combine that with a day by the water. And that can just lead to, like you said, seemingly competent people that maybe have the skills and have the knowledge of these waterways, getting into trouble because they are impaired due to alcohol and maybe are taking risks that they wouldn't normally if they were sober.
Is there any data around how that segment can be pulled apart in terms of, is it people who are picnicking and they're enjoying a swim? Is it people who are on a boat, or canoeing and they fall over? Is it related to, flash flooding type, scenarios where more debris is maybe coming down and happens in the, weeks afterwards? Is that segmented in any way, or is data allowed to sort of shine a light on the different variations?
Yeah, I mean, we're very lucky in Australia that we have very high quality data on injury causes, including drowning. We have the National Coronal Information System where sudden and unexpected deaths, which drowning is one, gets investigated by a coroner, and information is put online for researchers and people that work in prevention, including coroners, to look at previous cases and that kind of thing. So we have very good information on that, including, the blood alcohol concentration, when the autopsy and the toxicology reports are done. So we have very good data on that. With respect to alcohol, it's usually, it's less of an issue on boats because we do have some legislation around that, particularly if you're the skipper. But we do see it, kind of evening, early morning hours, people maybe falling in or jumping into water after a big drinking session, or even just spending the day, particularly public holidays, near the water and maybe having a little bit too much to drink and then jumping in from height or a rope swing or something like that. But it's typically recreational, a recreational, I guess, engagement with water, and then adding alcohol on top just really increases that risk.
And people jumping into the water, and my apologies for my naiveness, is it a scenario where someone jumps in and they dive in and they hit their head? And is it that they dive in, they get stuck under debris? Do people jumping in with their feet, and I don't know, it's shallower than what they expect and their feet get stuck in the ground or something? How does someone actually drown? And my sincerest apologies for naiveness and also for any listeners that have experienced something like this. But I think it's important to try and shine a light on this, because it's hard for me to understand, as I'm hoping others might appreciate as well. How does this happen?
I think the things you've mentioned have and can and have all happened in cases where people have jumped in, particularly where alcohol is involved. You can be intoxicated and disoriented, particularly in murky water like in a river, not know which way is up. You can incapacitate yourself to the point where you might be paralyzed and not be able to swim. We see spinal injuries and those kind of things happening, particularly when water is too shallow or you've hit a submerged object. Again, a real problem with rivers where you can't see what's underneath the water due to how murky the water is, and the fact that maybe when you jumped there last week or last season or before the last rainstorm, it was fine and things have changed now. And even just the combination of an injury and drowning, so rendering yourself unconscious or something like that, and then still being under the water and breathing in, but you're breathing in water, and that starts the drowning process. And I mean, you touched on, incidents where fatality isn't the outcome. I think that's important to talk about as well. People hear drowning and they often think death, but really the definition, and I don't want to get too technical for everyone listening, but it is a process of experiencing respiratory impairment due to liquid. And so you can stop that process before it ends in a fatality, basically through rescue, through resuscitation, using a defibrillator, getting medical care. So we do have, much higher numbers of non-fatal drowning in this country than fatalities. But rivers, when we've looked at it, actually tend to be more fatal than non-fatal. Backyard pools, beaches, because there are bystanders and people around, you have more non-fatals to fatal if you look at a ratio. But for rivers, it's usually a negative ratio. It's more likely to be fatal due to some of the reasons that we've talked about and the lack of bystanders and further distances to medical assistance. So, yeah, it's absolutely a spectrum. We've got a lot of non-fatal incidents as well in this country that need medical assistance. And, beyond alcohol, there's a range of risk factors that lead to drowning that, are all preventable. These are all avoidable incidents. And yeah, given the impact it has on our communities and our families and our health services, it's really important to spread the message, I guess, about how we can reduce our own risk or the risk for children or our loved ones.
You definitely see how the alcohol in particular, when you've mentioned things like being disorientated or, whether it's paralyzation, but also when someone is heavily intoxicated, a lot easier for them to faint, fall unconscious. I think your body's already compromised. It doesn't take nearly as much to tip you over. And if you're in the water, murky water, no one can see you. How do you go out and wake them up or do any of the regular response stuff, put them into recovery position? You immediately are overwhelmed with the water. No one can find you. Happens so quickly. A moment where someone thinks it's funny to, I don't know, swing off a tree or dive in or for a gag, particularly us, Aussies, larrikins, we're trying to find a joke. I'm that guy, I'll do something to get a laugh because it's enjoyable for all of us socially to be doing something, do something silly. But with alcohol and water and rivers, particularly the alcohol stuff, I can see now the risk factors going up very, very quickly.
Yeah, it's definitely a big problem. And, we don't have the same kind of enforcement mechanisms at the river that we do at the beach. We don't often have alcohol-free zones or they're not enforced. Much easier to kind of, have a few drinks and drive home from the river where in the country rather than the city. There's and boating, you've got to have a police boat with 2 police officers on board, at least if they're going to seize your vessel if you've been drinking. So it's just easier to do these things, unfortunately, in the country. And then there's those other added risk factors that go on top. But yeah, I think it's really important that we talk about all the risk factors, I guess, that contribute to drowning risk and talk about the burden globally as well, because it's such a big issue that is growing in attention. But, they're all entirely preventable incidents that, you can see what has gone wrong, I guess, and that's why we try and educate people on how to reduce their risk.
Before we jump into all the risk factors and maybe dissect that some more, is age a particular issue? And I say this because I'm an avid lover of nature. I go camping lots and I'm always searching for water. That's where I want to spend my time. And I didn't do very much camping when I was younger, but I would definitely see myself, if I was camping as a younger person, alcohol most certainly would have been involved. And then shenanigans most certainly would have been involved. As we're now, the love of the water is just really to enjoy, and you're much more less likely to take silly risks and the like. And there's much less alcohol involved. It's more on a pleasure rather than intoxication level. Is age something that is correlated, shown in the data to show up as more common among the younger cohort?
Yeah, I mean, I guess putting alcohol aside for a second, age is a big risk factor for drowning, both for young children under 5, particularly bathtubs, home pools, inadequate or kind of non-existent pool fencing, and a lack of adult supervision are really the key risk factors for children under 5. Very rarely does a young child drown in a river at the beach. It's usually in and around the home. And then if we skip to the other end of the lifespan, we've got increasing numbers of drowning in Australia among older people as we're all living longer. We see people taking a sea change, moving to an environment, a coastal environment they may be unfamiliar with, getting back, buying a boat or getting back into aquatic activity when they haven't done it in quite some time, maybe recalling their skills and fitness that they had in their 40s and now in their 60s. And even, the impact of underlying medical conditions, whether the person knows they have that or not. Heart disease is a really big issue, particularly if you're under stress in the water, and then you can experience a cardiac event as well. And then just going back to the alcohol, the thing that struck me with the rivers research when I was looking at this, and this was both looking at the coronial data and looking at the readings for alcohol, but we even went out and breathalyzed people beside the river, and that's a very interesting story to speak about that kind of research, because it was fascinating, scary, but fascinating. But what struck me with the river drowning statistics and alcohol was that this was an issue from go to woe, from underage people that shouldn't really be drinking to people that you would argue probably should know better in their 60s and 70s, out boating and drinking and getting into trouble. And as a researcher and someone focused on prevention, I really had to sit and think, like, what do I do with this? This is an issue across the board. There's no real kind of age group that sticks out, because everybody is, unfortunately, among the alcohol, there's the whole spectrum, particularly with rivers. So I do think our attitude more generally to alcohol is changing in this country. When we did go out and breathalyze people, I'd, roll up on a group of young people thinking for sure these, I was going to get interesting readings from these people, and they were actually non-drinkers for lifestyle or health reasons, had just chosen not to drink. So I do think there's a shift, but, coming back to age, how we encourage behaviour change amongst potentially people who've been doing this for a number of years, always take a slab out with the boat and have never had any problems before now, how to change behaviour when it's so entrenched and so stereotypical even of the Australian experience is actually really, really challenging from a prevention point of view.
It's really surprising to see even the older folk. If I was to run some hypotheses, I would definitely put age in there as a factor, particularly once you're 40, 50, 60, but it does make sense the moment we start thinking about whether it's a sea change or going out and saying, hey, I'm going to get back in there. I was fine. Your mind is still 40, but your body's 60, 70, whatever it might be. It doesn't take much to get into trouble. And also, as you say, that underlying medical conditions, a bit of stress, cardiac arrest, and the rest is going to be very difficult to come back from. So yeah, very, very surprising.
I think it's
attitudes
tricky
as well. Yeah.
Yeah, and just the norms, and I think all that stuff is shifting, but I also keep coming back to this idea of working in injury prevention or drowning prevention. It's such a grim topic, and we're often focusing on what's gone wrong, but we don't want to stop people getting in the water and enjoying themselves in the water. It's just really about how to do it safely. So there's nothing wrong with a sea change. There's nothing wrong with getting back in the water in retirement. It's about, being aware of your limitations and how things may have changed, trying out your skills in a public pool where there's a lifeguard and you can touch the bottom, before you take the boat out or head to the river. Just simple things we can do to kind of still enjoy the water, but just make sure that we're doing it safely and it's not all this kind of doom and gloom.
And there's that risk assessment side of whether anyone's even done a risk assessment. Is gender, are there different stats for the genders?
Yeah, so I guess like a lot of injury mechanisms, drowning is similar in the sense that males are very much overrepresented. Globally and in Australia, it's about, 4-1, 80% male. Where alcohol's involved, it's maybe even a little bit higher. But yes, disproportionately, men are overrepresented in our fatal drowning statistics. We do see higher numbers than expected in non-fatal drownings amongst women. So women are still getting into trouble, but obviously it's not ending in a fatality. It's being I guess the drowning process is interrupted and they get medical assistance or get rescued. So, if you look at fatalities alone, it's men, men, men. And if you look at non-fatal, you can see there's kind of a burden there amongst females as well that we wouldn't maybe expect if we just looked at the fatalities. So absolutely, there's things going on there. We started to kind of try to understand why this was the case around the rivers research and looked at visitation and usage of water. And we found that actually men and women go to the river in kind of equal proportions on average throughout the year, but women were less likely to get in the water. They were doing the picnicking, the walking beside, less likely to actually enter the water than males. And males are spending longer in the water. We know there's the risk-taking behaviour, the alcohol that can be a bit more prevalent amongst males. But again, when we went out and breathalyzed, we had very high readings amongst women as well. They just weren't getting back in the water. So, there's something going on there with gender. There's absolutely all these kind of social norms and kind of gender roles that are still a bit kind of entrenched in this country, but there is a bit of a differential there with exposure as well, literally the exposure to water and therefore the risk of drowning.
Any clues that you can offer, any hypotheses that you want to go out and test about what could some of those factors be, if you have to hazard a guess?
Yeah, I mean, I think that work we did around the river really showed that it's the not just nearby to the water, it's literally being in the water and the amount of time spent in the water, and that differs between the genders. And I think, when you see, the alcohol readings come through, known kind of risk-taking behavior or less willingness to, I guess, use a life jacket or observe kind of those safety rules, you can kind of see how it compounds for men and why we see males overrepresented in the fatalities. But yeah, before we really looked at exposure and visitation, who's going to the water, how they use it and how that differs by gender, we really didn't know what was going on. We just kept seeing men coming through as, vastly overrepresented in the statistics, and it's really the same globally as well. So really, I think it comes down to a few different things, those norms and those behaviours and that differing risk perception, and just then greater exposure, literally being in the water and at risk of drowning as opposed to being beside it.
The stark difference between the fatal drownings and the non-fatal drownings, that men are so overly represented in the fatal drowning incidences. Has there been any research about the activities that men and women are doing in the water? Is there any difference between that or for example, I don't know, I'm just trying to pull something together, but are men going into deeper places? Are they, trying to get across rivers more often? What are we doing that is contributing to these numbers? Are we more likely to not test the depth of rivers beforehand, rather than gently walk in? What is it that we're doing? Is it is there any data around it? Do you have any inclinations about at least speculating?
I think it's a lot of the things you touched on. I mean, there's research from the coastal environment that shows that men spend more time in the water and go into deeper water than women. We know that there's differing risk perceptions between the genders, less likelihood of wearing a life jacket, more likely to engage in risk-taking behaviours like daring each other to swim across a river or jump off a high point or, those kind of things, whereas women are maybe a bit more risk-averse. Like we said, they're going to the water, but maybe wading, not getting in as far, maybe not getting back in when they've had a few drinks, as opposed to the men who will go back in. So I do think there's a lot going on around the gender norms and the perceived kind of behaviours that men think they need to show. But also, I've spent quite a few years kind of talking about this in the media, and I also recognise that I'm not a male who takes risks around the water. I'm very risk averse because of what I know and what I do. And saying to someone, you're a risk taker, people don't think they are taking a risk. That's why they do it. And so I still struggle with how we would communicate this effectively, because people don't think it's going to happen to them. They don't see what they're doing as risky. And so us saying, don't take risks around the water, this is risk-taking behaviour, it just doesn't kind of cut through.
Mm-hmm. Is there any data around the incidence of kids drowning proportionally, and does that vary with male supervision versus female supervision versus combined supervision? How does that space unfold?
So I think we talked about earlier that age is a risk factor for drowning, and in Australia and a lot of other countries, drowning is disproportionately impacting children and young people. Particularly in Australia, it's an issue for children under 5. And the risk really changes with those kind of developmental stages in that kind of 0 to 4 age band that we're talking about. So under 1, it's the bathtub and children being bathed and left alone while someone nips out to get a towel or answer the phone or answer the door. And that's why we always kind of say, take the kid with you, ignore those things, try and be ready before you get in the bath. If something's going on, take the child with you, because under 1, it's overwhelmingly the bathtub. 1 to 3, it's the home pool. And when they start to toddle around and get kind of more inquisitive with their environment and are drawn to water because of the way it moves, and maybe there are toys floating on it. In the country, that can be, a water trough, farm dam, and they can't be fenced because they're usually used by animals on the farm. So that really comes back down to supervision, or fencing in an area for children to play in rather than fencing the water body. But in the home environment, it's the backyard pool. It's rare nowadays in this country that we would have a pool that isn't fenced, whether it's compliant and whether the gate latches when it should and closes and hasn't been propped open. Those are the failures we tend to see. Combined with, in almost every case of child drowning, is that absence of supervision. The gender of the supervisor is interesting. I have done a little bit of work around that. It tends to be a different thing that the parent might be distracted by when supervision has lapsed. But I think one of the most compelling findings when we looked at child drowning and the reasons behind those lapses in supervision, so we could kind of talk to parents about these are the common distractors and these are the things you need to worry about and avoid doing, basically, were those cases of pool parties or barbecues, around water. Many adults. Some drownings occur in the presence of 10, 15 adults, but no one is supervising. And in that case, it's not safety in numbers. Everybody else thinks someone else is supervising. And that's where we really talk about, designating that role to somebody. Give them a hat, give them a toy, give them something. That is their job. They are supervising. They shouldn't be consuming alcohol. They should be kind of, of sound mind and concentrating on the task. If they need to leave or do something else, you pass that responsibility to someone else, because some of the most kind of upsetting cases I've read is just to think of how this could happen with that many adults around. And I think we talked about it earlier as well, like drowning doesn't look like it looks in the movies, particularly for young children. It is quick and it is silent. They can't call out for help. And so really it is our job as the adult supervisors to keep them safe.
I can definitely see how the pool party barbecue type scenario, and there's no doubt, and I'm sure every other parent has experienced the same, where you're with your children socializing, 10 minutes has gone by because you're in a deep conversation, something's interesting, and you blink and you realize that you haven't actually tracked your child for a period of time. Now, whether it's 10 minutes or whether it's shorter, whether it's longer, it doesn't matter. It could be a minute. It's so quick and easy for that to happen because, you have your other parent doing so, and no one's actually having this conversation about your job right now for this period is to do this and I'm going to do it. It's kind of like, oh, we'll both keep an eye on them. And I think it's a really good approach of saying, can we have a parent that's responsible for the body of water, whatever that might be, that's their job. And that you do pass it on, because, go grab a drink or something. You bump into so-and-so, you start a quick conversation and memory lapses about what your job is. It has to be a physical, I don't know, item that you physically have to hold or something, whatever the reminder is, but someone to be watching the water. It sounds like a great idea. And maybe also that comes with a bit of a culture, that people adopt something like that, we all have a plan B now if you're going out, we're not driving, I've got a plan B. Great campaign. We should be thinking about that. But bathtubs for under 1,
Mm-hmm.
1 to 3, home pools, farm dam, water
Mm-hmm.
trough, spas, I'm assuming is similar scenarios in
Uh,
that category, like
which,
spa baths type of
yeah, so
jacuzzis, but I suppose not too many houses have those.
yeah, I think they seem to be more common in North America and popping up in data in other countries. Technically the depth of those things and the purpose of them means that they should be fenced the same way a backyard pool is, but we don't see as many incidents in those locations. Oftentimes they have covers as well, kind of locked covers, but they should be fenced under legislation. And I would also agree, I don't know the statistics on ownership, but I would, suggest that we don't have as many of those as we do backyard pools because they're definitely not as prominent in the statistics. Actually, the drownings in spa baths and jacuzzis outside is kind of adults who are intoxicated and getting impaired in a spa. So it's actually less of an issue for children and coming back to that kind of adult and drinking a little bit too much in the spa.
Yeah. I want to touch on drugs versus alcohol in a minute, but just let's hold that thought. If I keep going, so under ones, we've done the 1 to 3s. Where do we see the 4+, 5+? How does that data show up?
It's a really interesting shift because you think about what's going on under 5 versus 5+ in countries like Australia. We see a really sharp decline in drowning rates because kids are at school, right? So they're supervised a lot of the time. They're kept safe. They don't have as much leisure time. So we see really sharp declines in the 5 to 9, 10 to 14, and we attribute that to the schooling system, another great reason to go to school. But we do see those spikes then in school holiday periods. So we often try to remind people, you might be going to an unfamiliar location on holidays. You're not in your normal pattern of activity, and there's just more leisure time, and particularly at this time of year when the school holidays coincide with festive periods and drinking and longer days and hotter weather. We're just kind of exposed to the risk of drowning more just through our usage of the water. But yeah, it's very low. It moves towards natural waterways as children get older, so the beach and the river, but very low risk from 5 to 9, 10 to 14. Starts to creep back up then from 15 to 17 and kind of into that older adolescent, early adulthood period. And we really attribute that to kind of a change in supervision. So you're more likely to be with your peers than your family, start to be able to drive a car, to go to places further away or places that are unfamiliar. Yeah, being with your friends, not your family. Maybe the drugs and alcohol start to creep in, the peer pressure, if you haven't learned to swim by then, it's an embarrassing thing to admit that you can't. All these things kind of change, and then kind of drowning just kind of keeps going up through adulthood where, the medical conditions and the alcohol and those kind of things come in. But yeah, it's really interesting to see how much the drowning rates just decline in those school years.
That's very fascinating. Very fascinating. Let me jump across to the drugs and alcohol if you don't mind if we come back to that. We've obviously established, and you've mentioned that the alcohol and quite significant intoxication. Maybe you can even talk about that, what the sort of readings are if that data is available, and is there a similar pattern with drugs? Are drugs showing up with the same type of disinhibition or the risk taking that comes along with that? What's the data saying there?
So the alcohol, I mean, we've only really looked at usage and consumption as opposed to looking at the death statistics and the blood alcohol readings at death. We've kind of only done that for the river environment. So I can't really speak to the other environments, but yes, the readings we saw at rivers, particularly on these hot days. Australia Day was the worst day by far, just the amount of alcohol being consumed. I think we had someone blow 0.35, which is, what's that, 6.5 times the limit. The average on Australia Day for both men and women was, from memory, 3 times the limit. A lot of alcohol being consumed. And if you're not capable of driving a motor vehicle, you're highly unlikely to be able to navigate kind of water safely either. Be it swimming, obviously on a vessel, all those kind of things. So yeah, it seems that there's quite a lot of heavy alcohol consumption going on. And look, we were there during the summer, it was weekends, it was public holidays. So, you know, we do know that those are the risky points, but it really did suggest that there's a lot of alcohol being consumed around the water at our rivers. We also surveyed them. So we breathalyzed them and we did a survey. Where researchers, we love a bit of data. We love to do a survey. And we actually asked them about their general alcohol consumption and looked at their audit score, which is kind of a measure of how much they drink in general. And these people were heavy drinkers, right? So yes, they were obviously a heavy drinker on that day at the river, given the reading that we got from them on the breathalyzer, but they were people that would drink a lot, you know, above the standard daily or weekly consumption that is kind of recommended in Australia by health authorities. They were drinking more than that regularly and regularly binge drinking. So it kind of made me shift my perception as well about these are people that take risks with alcohol in general, regardless of where they are. And so what's really going to make people listen for a message around river safety as opposed to anything else, because these are just people who love to drink a lot of alcohol. So that was quite an interesting finding. When we think about drugs as well, there's a link with the alcohol. So when people are drinking, they're actually more likely to have consumed illicit drugs as well. So you've got that double whammy there of a kind of double intoxicant, I guess, impacting you. But even the non-illicit drugs, so we even look at kind of prescription medication, because we do often get the toxicology reports in these cases to know kind of what was going on. We even need to caution people who are on medication against drinking alcohol as well, because sometimes they can interact. Obviously, for a lot of conditions, it's safer to take your medication than not, but it can render you drowsy. You know, on some medications, you're not recommended to operate a vehicle, so you're probably not safe to get in the water. And then if you mix that with alcohol, that's a really bad time as well. So a lot of links between the two, and even kind of risks in people kind of, even with prescription medication and medication that they're supposed to be taking, combining that with alcohol and then getting in the water and it kind of ending in a fatality.
Yeah, very, very fascinating, because so many medications have a sedative effect, and yeah, we don't go out and say, be considerate about, operating. I think they even used to say operating heavy machinery.
Heavy machinery, yeah. So don't take the tractor out, don't take the truck out, don't take the car out.
But jump on the motorbike, that'll be fine. But I don't think I've ever seen anything about, a warning around swimming, for example, or that effect. It's interesting to look at it in so many ways, and also that trend about how do you do behavior change if there is that link between people who are drinking in a risky fashion anyway. This isn't just the river. This is potentially, at least from an audit perspective, looking at the data that's coming back, there's risks being taken quite frequently, but there's going to be those peak times when people are celebrating Australia Day, disinhibited, probably drinking more than they usually would above that regular drinking as well. We I suppose pile on one risk on top of another risk on top of another risk, and frequency, and sadly, statistics are saddening there. Can you talk about non-competent swimmers? How are they accounted for in the data, and is that something that is hitting a particular population of our society? Obviously, younger people are there. I come from a migrant family, and I know that some people from my background haven't learned to swim. At the same time, I don't actually even know whether that data is any different to Australians learning to swim. This is all just theoretical. So what's the data saying about non-competent swimmers or people who haven't learnt to swim?
Yeah, we would think logically that not being able to swim is a risk factor for drowning, but capturing that information, particularly in the coronial system where you can't interview the person about their swimming skills because unfortunately they have passed away, it's very hard to get that. That's not often captured in a police report. It's definitely not done in a standardized fashion. Someone might say, oh, the decedent was a, experienced scuba diver. The next person might say, they had some swimming lessons, or confident swimmer, competent swimmer. You know, the way we might describe swimming ability is very different. Is it even recorded? Is it accurate? It's just a very difficult thing to get data on. But obviously, we really encourage people to learn how to swim, particularly in public pools, which are the safest places to go in terms of the millions of visits every year and the very few drowning deaths. They're the safest place to swim. So we do encourage people to learn to swim, but it's a real challenge. I think there's a great line that a colleague of mine uses, that we're not a nation of swimmers anymore, we're a nation of waders, because we're not fit enough, we haven't learned, we haven't practiced our skills recently. And there's just a lot of pressures. I mean, the COVID pandemic changed things for a lot of people, but, you know, our pools struggled to reopen, struggled to find the staff. The costs are going up. So in a cost of living crisis, I would hope people prioritize this, but it's non-essential, I guess, for a lot of people when you're really struggling to get by. So it can be very expensive. The other thing we see is that there's a lot of pressure to enroll children very early in Learn to Swim. And you might burn a few years when they're, you know, 1, 2, 3. You're broke, they're over it. They haven't really learned because they're still quite little and not capable of kind of mentally or developmentally putting those skills together. So there's a lot to be said for just enjoying the water informally with your kids and making sure they're comfortable putting their face in the water, and starting swimming lessons when they're a little bit older, when they're going to get better value out of it, and you're going to get better value out of it for the spend. Because for those kids that do participate, you know, I think it's about 40% don't reach the minimum benchmarks that Royal Lifesaving advocate for kids at certain ages. And these benchmarks are minimums, right? They're not that extreme. They're kind of the minimum standards that we'd like to see kids have. So there's a range of challenges there. And then when you think about maybe people from migrant backgrounds that didn't have the opportunity to learn to swim, that can kind of go both ways. Either it's perpetuated and then the next generation doesn't learn and the next generation doesn't learn, or actually families come here and really want their children to have the opportunity that they never did. And there's even been cases where the kids' ability has then outstripped the parents' ability, and they go and learn and go into adult Learn to Swim so they can keep up with their kids and they can all enjoy the water. So it can kind of go both ways, but I think absolutely we shouldn't assume that what we see on the Olympics and our incredible performance in the pool is indicative of kind of the skill level of the population, that's for sure.
And look, I can definitely vouch for that. I remember when our children, my children went to swimming lessons, I was, you know, talking with my wife and going, what are we doing? This is ridiculous. We're, you know, paying for splashing about. Nice for the first instance, but then what are we doing? Thankfully, we've persisted and kind of gone on and off, on and off. But I would most certainly agree with you in terms of spending the time when they're a little bit older. And also for me personally, I think doing intensive swimming lessons versus this kind of weekly excuse it, but I'm going to put it out there anyway. Some of it feels a bit nonsense. Because you just can't go out and do skill development unless you fully persist for an extended period of time, versus a kid who goes, you know, every day for 5 days, and maybe a lead up prior to that, but the acquisition of the skill just skyrockets with some intensive, you know, sessions.
Yeah,
at least
absolutely.
That's been my experience.
Yeah, and I mean, I think if you can afford it, it's a great thing to do when they're little. You can get in the water with them and really have a great time. You know, they will be better swimmers at an earlier age if they've had that opportunity to practice. But for people who cannot afford it this whole time, I would encourage starting later. And you're absolutely right that, you know, you can see greater progress over a shorter period of time with more frequent practice of skills. Some research we did around children's Learn to Swim ability showed that kind of at least once a fortnight in the water, even informally in any type of water, meant that they were a better swimmer when they got to swimming lessons. So even practicing that, you know, while the weather's warm, going to the public pool, if you've got lucky enough to have an indoor pool near you in the winter, you know, maintaining those skills and practicing and keeping that skill up is really important, because you absolutely just see the benefit of that kind of more frequent practice, even if it's just informal reaching for something in the pool or splashing around. You know, that can all contribute to greater skill development when you get into the formal lessons. And you absolutely see greater progression with intensives, but unfortunately they usually run around holiday periods, and so you'd want to try and keep that up in term time. So it's a bit of a balance, but I think, recognizing that it's a great thing to do for fitness, a great skill to be able to have and enjoy the water to cool off if it's hot. It's a great skill, probably one of the only sports that will save your kid's life. So, if you can prioritize that over other sports, that's what I would be trying to do.
And is there a offsetting factor of someone being quite competent, considering that, and obviously this doesn't account for every incident. We've kind of focused a lot on the rivers, but being a strong, competent swimmer, I like to think it makes logical sense that there is some level of mitigation that provides, that there's a safety improvement there. You're going to be less compromised, even if you are intoxicated, at least in theory. I'd assume that there is some buffering that provides.
Yeah, you would think so. I mean, really, we do not have the data on that because, as I mentioned, the how to assess population level skill of learn to swim. You ask someone, can you swim? Can you swim? No real set definition, very subjective. It's a very actually difficult thing to measure. In the fatalities, we don't even really know. But yes, you would assume that it would provide some protection and maybe that knowledge as well to not drink the second beer and to jump off the thing, I think it all kind of contributes to being safer in the water and just, having the skills to enjoy the water as well. Fitness as well.
Yeah, it's intuitive, and at the same time, the reason why we need the research is it could have the other effect, right? It could be that your confidence goes up, because I've got this, I'm a good swimmer, versus potentially not being a great swimmer or not knowing how to swim. You are saying, I'm not going to go near it. This is really risky to me. My alarm bells are going off when I'm 4 meters away. I'm not going to be the one that, I don't know, goes to get a ball out of the water, accidentally fall in, because I know this is a high risk thing. These intuitive ideas need to be, tested. They need to be researched and looked at, because otherwise, we're just pot shotting.
Yeah. And I mean, think about the ethics of this too. Some of this is quite difficult ethically to kind of justify, I guess, in terms of the research, but it can go either way. I absolutely agree that someone without the skills, if they know that they don't have adequate skills, that's the other thing. Do you have the knowledge to know that your skills are not adequate to keep yourself safe? But we know with children that just trying to avoid the water doesn't work, right? So particularly for children, keeping your eye on them and supervising them actively, but giving them the skills as well is really important. But it could go both ways. I hear about these kind of short-term programs that expose people to things, and one of the outcomes is that they're more confident, they think they're fine. That does worry me, because how much skill can you really attain in a very short period of time? And has your confidence now kind of gone above your skill level? And is that confidence and skill going to be commensurate to the type of environment that you're going to encounter? It's actually very complicated when you get into it, but hopefully we've communicated to your listeners that, look, learning to swim is a great thing to do, and really to prioritize it if you can.
Absolutely. I suppose like a lot of things, the risk factors are not only about one, but rather one and the compounding effect. Similarly, the protection effect is many things, not only monitoring kids in particular, but, we'd be saying monitoring your adult friends as well, right? Especially when alcohol is involved, which is another obviously big factor. Have we covered off on the risk factors, and if not, can we not an exhaustive list, but is anything else that stands out there? And then maybe you can talk through all the protective factors, because that's always important about what can we do as individuals, as parents, as in actual fact children of an aging parents.
Yes, I think we've really talked about a lot of the key ones. Many of the kind of, there's obviously a lot more, but I think we've touched on many of the key ones. And yes, we always try and, I guess, not just raise a problem, but bring up the solution as well. So very important, I guess, to talk about prevention approaches. I guess the other thing which we've kind of circled around is, for rural populations, the risk is much greater. It's kind of, we sort of touched on it in rivers, but just in general, if you live in a rural area, the risk of drowning is 2 to 3 times higher than the city for those kind of reasons that we've talked about. And a lot of country areas where I grew up included only have a pool that's open half the year and might struggle to attract a swim teacher, and kind of all the health system challenges that people in the country face, and socioeconomic status as well. We see much greater rates of drowning in low and middle income countries than we do in high income countries. And even within high income countries like Australia, it's areas with greater socioeconomic disadvantage that we see higher drowning rates. So I would say that that's probably the same for a lot of injury mechanisms. There's, a lot of, no money to spend on interventions, maybe a more dangerous environment that you're recreating in. So there's a range of factors there, but I think those are two other key ones to mention is remoteness, and the more isolated you are, the higher the risk, and socioeconomic status as well.
And I can see that could potentially be moderated by the closer you are to the beach in general, the higher the costs in general. And as we've said, patrolled beaches for Australia, at least, patrolled beaches, a lot more awareness, and the like, and probably more people visiting those spaces. So, so many factors to consider, and yeah, clearly the rural place are pretty much going to predominantly be rivers and the like, dams, lakes.
Yeah, farming populations. But I guess, like you said as well, the more kind of urbanized environments, those coastal locations are probably more likely to have patrols to be able to sustain a workforce to run those patrols, or have a council that's willing to support that with funding. So, yeah, even coastal locations that are regional or remote would have higher drowning rates because they're going to be an unpatrolled location, less chance of bystanders, all those kind of things. So as we've mentioned, there's just a range of risk factors, I guess, that intersect.
Protective factors. Where do we start?
I think we have mentioned a few. I mean, we've talked about learning to swim, and I really would encourage people to learn to swim. Again, you can almost segment it by age in terms of prevention strategies, or even the activity you're undertaking or the location. But for children, I think I mentioned this earlier, in almost every single case of child drowning, it's an absence of adult supervision, either complete absence or like a temporary lapse because of a distraction, like we've talked about, be that devices and mobile phones and things, or even just busy parents needing to try and multitask and do other chores inside the house or outside the house. So, and that element of socializing as well in those social environments of just chatting and getting distracted. But yeah, restricting children's access to water, active supervision at all times for young children is really important, and really within arm's reach. So, you should be dressed and ready to get in the water. And if they're kind of under 5, you should really be in the water with them or within arm's reach so you can react quickly. Learning to swim obviously is very important, but then we also talk about those kind of tertiary prevention measures that after the drowning incident has happened, it's really important that you know how to safely rescue if you have those skills, or how to perform CPR should you need to, because as we said, drowning's a process, and if you can kind of intervene, you can kind of save lives with, rapid rescue and resuscitation if we haven't managed to prevent the initial incident from happening. Obviously, the opposite, I guess, of all the risk factors we talked about, so not drinking alcohol, not jumping off bridges, not jumping off rope swings, not pushing people in the water, especially if you're not sure if they can swim or not. Life jackets are really important. We're seeing increasing legislative motivation, I guess, for people to wear life jackets, be they rock fishing in high-risk locations or on certain size vessels in certain risky locations. But yeah, having a life jacket is really important.
That's legislated now. Life jackets for fishing in certain locations where, rock fishing, I'm assuming, is a big one. Obviously, we know about, being on boats, and I know that's heavily policed in actual fact, or which is good. That's the way that we want it. Not only have you got them on board, are they being used? And when was the last time they've been checked? They've got expiry dates as well. They're it's really culturally shifting.
I think it is, yes. And I mean, again, I would say there's more chance of a blitz and you're getting checked on your boat in Sydney Harbour than you are out in Whoop Whoop on a river.
Yes.
But yeah,
Yes.
there's definitely legislation around life jackets. Interestingly, sometimes the legislation is just you've got to have it on board, not wear it, which to
Oh,
me seems crazy. So I'd encourage people, don't just have them on board, put them on. When something goes wrong, you're not going to have the time to reach down, get them out of the packet and put them on. So just
you can
wear
have
them.
a fire extinguisher, but you can put them in the basement. Yeah, that's fine. Just put them in the cupboard.
And your point about kind of checking them, the expiry dates as well, like maybe people don't realize, but life jackets these days are very slim fitting. You wouldn't even know you've got one on, and they inflate when they hit the water. So they're not these big bulky things that you might kind of think are hot and sweaty and kind of impede your movement. They're much more slim fit, easy to wear these days, but they do have gas canisters in them that are meant to, automatically inflate the life jacket when it hits water, and you have to kind of get those checked and replace the canisters as well. So that's really important. But for rock fishing, yes, I'm not sure if people are aware, but it's one of the most dangerous sports you can do. Very high death rate from rock fishing, very risky. But I can at least speak to New South Wales because we have done some research there. Using the statistics, the government identified kind of high risk rock platforms where there've been kind of a concentration of fatalities. And in those locations, it is legally required that you wear a life jacket, and you can be fined if you don't. A lot of the issues with rock fishers is people that probably can't swim. You can get incapacitated, knocked out when you're swept in. And so having that life jacket can really kind of help you kind of literally keep your head above water if you're swept in, but also help someone find you as well should you be rendered unconscious.
How successful have these initiatives been? Obviously, most people know that swimming pools have to have fences around them, and I know even here in Canberra, most recent thing I've heard is the grandfather clause of selling a home with a pool in it is changing, whereby you're going to be able to sell it without a fence. However, there's a particular date, which I think is this year, in which if it doesn't comply, the owner will have to rectify it, which means fill it in, or do all the works to actually comply. This is after many, many years of a fence requirement being in place. But we're at a stage where the whole grandfathering clause is now being thrown out, and if you are buying a home with a pool, you're going to have to comply, or I believe it's actually you can't sell it without it complying. So it'll force the function of those people either holding onto it as it is, or at the moment they need to sell it, they have to do something about it. Now, I don't know if that's fully accurate. I might have, misrepresented, but yeah, forgive me for wherever I've messed up.
We might encourage the audience just to Google their requirements in their own states and territories. But yes, there's similar.
Thank you for saving me.
Disclaimer. There's definitely different rules in different states, which also makes it challenging, in a place like Australia where that's handled at the state level. But yes, in many places, there's kind of rolling inspections of pool fencing just to see if things are compliant. And then usually, you need a compliance certificate for sale or lease. I know at least in New South Wales, and it sounds like maybe you're describing something similar in the ACT, that if it's not compliant at point of sale, then the new owners can kind of negotiate that off the price and have a time period within which they can fix it and get the compliance certificate as the new owners. So that's, if I'm ever going to an open home, I'm that nerd that like flicks to the back of the contract to see if there's a compliance certificate for the pool or not. So, and oftentimes, I've very rarely seen one that's completely compliant. There's wear and tear, there's things that can go wrong. Someone doesn't have a CPR sign, someone's got a climbable object where it shouldn't be. Very easy to have a non-compliant pool fence. So I do think those things are very important and effective. I mean, we've reduced child drowning rates in this country for children under 5 by, I think it's about 60%. We used to have a child a week in Brisbane alone drowning in a backyard pool in the 60s and 70s. The numbers were horrific. And through a range of interventions, alerting people to the need for supervision, enrolling children in Learn to Swim, learning CPR and first aid, but predominantly isolation pool fencing, where we kind of separate the house from the pool, has been incredibly effective. And I would say probably our system is the envy of the world in terms of that. Countries like the US with extremely high pool ownership have horrific child drowning rates, and a lot of states in the US that don't mandate pool fencing. So absolutely, it has saved hundreds and hundreds, if not thousands, of lives since we brought that in. So one of the real kind of real success stories, I guess, for child drowning prevention is those barriers.
It's incredible, isn't it, that human beings, we can run all of these behavioral interventions, but ultimately putting a gap in between is the best, or at least has contributed the most. And that does not necessarily, that does not mitigate the importance of learning to swim and the rest of it. But, going out and legislating this requirement of saying you've got to put in a fence, and that's just it, full stop. There's no other way around it. Just makes sense, and the compliance around that in terms of an auto swing close fence, and you can't have anything nearby that you can climb on top of. That's permanent, I suppose. It's remarkable that you said from the 60s that there's been a 60% reduction in under fives.
The 60% reduction is
Pools.
in about the last 15, 20 years. But I just recall, obviously, predates my time, going back to the 60s and 70s, but I've got colleagues, mentors that, were pediatricians in Brisbane back in the day, seeing these kids come in because everyone was putting in pools, putting in the fiberglass pools, and no one knew. And then these children started turning up in the emergency rooms, and something had to be done. So anything takes time, and legislation has evolved over time. We have that education and that enforcement as well. And even the technology around the types of fences and gates has improved. But yeah, the advocacy and the legislation around this and the compliance within the community has absolutely dramatically cut the child drowning rate in backyard pools in this country.
Are there any building codes that are in place around the height of baths or anything like that has also seen a reduction in residential home drownings?
Yes, there's rules around you've got to have kind of compliance and building checks done before you can fill the pool, for example. If you're putting in a pool, you have to have temporary fencing because it can fill up with water. There are kind of Australian standards around pools and the construction of them, and it gets very complicated, but the non-climbable zone and the way we might engineer these things to actually isolate them and what's allowed and not allowed, all based on the evidence. So there's building codes, Australian standards, legislation in each state and territory, and then I guess the enforcement mechanisms as well, alongside all the education. It's obviously a long-term commitment that has kind of really been powering on since the 60s and 70s, but a very, very effective child drowning prevention intervention.
You mentioned Australia's envy of the world in this sort of space. What are we seeing around the world, if you can, generally comment about, what the data looks like?
Mm-hmm. So drowning is a big issue. We've already hopefully communicated to the listeners that it's entirely preventable, but a very big issue around the world. The 2021 data out of the World Health Organization indicates 300,000 lives are lost due to drowning around the world in 2021, and the vast majority of those are in low and middle income countries and among children and young people under the age of 29. So very much a child issue and very much a low and middle income country issue. The thing that is one of my little bugbears, I guess, and kind of rallying cries that I try to communicate to people is that those figures don't include drowning on boats. And when you think about the ferry incidents, the shipping, the recreational vessels, and you think about the countries where those kind of disasters and incidents can occur, it's going to be a very big underestimation. It also doesn't include drowning due to disasters like flood and tsunami and storm surge. There's often a lot of countries, even in our region, very prone to that, and increasing severity and frequency with climate change. So, 300,000 is a big number, but the toll is much, much higher if we were to pull in all those other causes as well. So it's a staggering figure, and it's an important tool for our advocacy and to communicate with people and governments and donors the scale of the problem, but it's even bigger than that.
What are the campaigns that we see in Australia, or is there anything on the horizon? Where do you see we should be investing in? Although we're the envy, there's clearly a lot more to be done, and we should remain the envy of the world as well, because we should be pushing hard and setting a standard, and our learnings can then filter through the world, because they can look at us and say, let's do what they've done because we've got data to show it. But where would you like to see Australia go, or what's on the horizon that you might be aware of?
I think we've really got a very strong commitment to that data quality and that research to understand why these incidents are occurring. There's a lot of other countries where the cause of death data are not great. The true burden of drowning is not known, particularly if you include the disasters and the shipping and the ferry incidents. So we are lucky in this country that we have good cause of death reporting and know a lot about our drowning situation, and therefore can track the effectiveness or otherwise of interventions as well. So obviously, and there's a very strong commitment to that by Royal Life Saving Society Australia, by Surf Life Saving Australia, by researchers like myself, and many others that work on it in this country. There's a strong commitment to that, and that, we want to see that commitment continue, I guess. We need to keep funding interventions, particularly those that we know work. So our patrolled beaches, and thinking about how we might ensure safety at unpatrolled locations, because we can't patrol every beach all the time. And, growing investment, I guess, there is in our rivers and our inland waterways, but just kind of keeping that up and not losing the momentum we've gained there in making people realise that that's a leading location as well. I'd like to think that the behaviours are changing with alcohol and water, but maybe if I was to repeat my breathalyzing study, I'd see the same kind of concern. So I do think that's one of the big things that we need to tackle as a country, is not having such a lackadaisical attitude about alcohol and water, not thinking that they go together. It really should be considered not a socially desirable activity. And we're not saying don't drink. We're saying kind of do your aquatic activity first, and if you're going to have a few drinks, don't get back in the water. We're not going for the abstinence model. It's really about kind of making a better risk assessment and a better judgment call, and kind of avoiding combining the two, because I think that's one of our big challenges, particularly as we talked about earlier, that it's people of all ages, stupid amounts of alcohol. It's very hard to know how to change that, and I think we need to reframe that.
It's I can definitely see the need or the value, the desire to look at attitudes and culture, particularly around how we do water activities and alcohol. Because I spend so much time in the bush and I've got friends that are like-minded, a number of my friends have got firearms, and the culture around firearms is absolutely incredible. They're carried with such regard, at least in the circles that I've seen, and I've met new people that I've not known before, and there's a culture around how you secure a firearm, how to use a firearm, how you transport a firearm. Obviously it's police, but there's also respect around it. It's not you go out and get on the drink and then carry on. And I know that's not 100% in all circles, and I'm sure rurally there will be people laughing at the moment at what I've just said, but there is a culture that goes with that space, and it would be nice to see something that addresses that says, hey, enjoy the water, hey, enjoy shooting, enjoy the outdoors, but maybe don't litter, maybe don't don't be intoxicated while you carry a firearm, or this is how you carry a firearm, and the requirements of safety and security and the like. And maybe do your water activities before you drink. even if it's not legislated, but having a culture that goes out and thinks about it. Because even if we mitigate it by 50%, the disinhibition that alcohol brings, that's, we just know it's results in so much death and injury and social problems and the like. At the same time, we don't want to remove alcohol from people. It's the use of it and how in our culture and the way we think about it. So I share your desire as well. It's such an important topic.
And I do think it's changing. And I mean, I haven't looked at the survey data and the drinking data more generally, but I do think there's less drinking to oblivion these days. And even when we went out and surveyed and breathalyzed people, there was a very different attitude to the people on boats than people who were swimming. There is a bit more of an awareness that it's risky to drink and boat. And I guess maybe because they've got to back the trailer down and, they don't want to crash and ruin their expensive boat. There's definitely some different attitudes around the boaters as compared to the swimmers. But then, when we ask them, is it acceptable to drink and drive? Oh, no, absolutely not. No one would say that's acceptable in the survey. Is it okay to drink and boat? Yeah, if I've had a few, or, wait a little while after I've had one. So actually, it could even be more dangerous than the road with the glare and the conditions and the boater's hypnosis and all this kind of thing. Yet we just don't have the same risk perception around boating and alcohol the way we do with drink driving. And maybe in time, with the benefit of campaigns and legislation, the way it's taken some time for the drink driving kind of message to get through, maybe we're getting there. But yeah, it was interesting to me that they're kind of both vehicles that you operate, and maybe you could argue that the boats are even more risky because of the water and the glare and all those kind of things. But there's just this different perception in the community, which is quite worrying.
And also aspects like what I find so fascinating is time in water. Particularly men spending more time and then being so overly represented. So much more to research. Where does your funding come from? How do you do your work?
Well, I think we're quite fortunate. I mean, not me directly, but organisations like Royal Lifesaving and Surf Lifesaving do have quite strong government support for research, for education campaigns, for interventions. And I know, again, we're sort of the envy of the world in that sense, because there's a lot of countries where it's not on the government radar. There's no one taking charge of this issue, because drowning can be a child issue, a climate issue, a gender issue, a work issue, a recreation issue, a transport issue. It's very multi-sectoral, which gives you great opportunities to kind of try and embed your message, but at the same time often leads to everyone saying, it's not my portfolio, it's not my responsibility. So we are lucky that we have that support here. In terms of my research, the usual researcher struggle of trying to secure funding through government schemes or things like the Australian Research Council or the National Health and Medical Research Council. But I'm really lucky that I guess not the traditional academic came into academia quite late, even maybe by some people's standards did a PhD quite late, and have always been grounded in industry and working with the media and with the community and in the not-for-profit sector as opposed to as an academic. So I've still got a lot of ties into the sector, and I do partner a lot with organisations like that to kind of do some research, bring the academic skill set or the resources that I can access as an academic, but, applying it to an issue that the not-for-profit sector or industry is facing.
Oh, fantastic. And where can people find out more if they want to continue this conversation or look up more detailed aspects around whether the risk factors or obviously the protective factors? How can, where would you say is a good place, whether it's websites, books, your work, data?
Yeah, I mean, there's a lot of research, a lot of it coming out of Australia, actually, just to kind of further toot our own horn in terms of how well we're doing globally. If you have a look at Google Scholar, there's a lot of research. You'll be able to find me on the UNSW website or just Googling my name, Dr Amy Peden. But in Australia, there's really insightful seasonal drowning reports, so a summer drowning report or over a whole year, a national drowning report. that comes out from Royal Life Saving and for Surf Life Saving Australia. So if you Google them, you can really get a good insight into kind of the trends and the risk factors for drowning in Australia. And then globally, the World Health Organization has really taken the lead on this issue and actually just in December last year released the first ever global status report on drowning. And that really, I guess, looks across, I think it was 139 member states that responded, you know, how they perceive drowning as an issue, what the data is showing for their country, and in terms of protective factors, you know, what have they got supervision of young children, you know, preschools, daycares? Do they have learn to swim in the curriculum? Do they have pool fencing or safe shipping regulations or early warning systems for disaster? It's a really great tool to kind of look and get a segment of many of the nations around the world in terms of what the drowning problem is and how they're responding. So if people want to Google the Global Status Report on Drowning Prevention, it's on the WHO's website. There's a lot of other resources on their website as well around drowning prevention.
Fantastic. And look, it's such an important topic. It's one that, you know, as I said at the start, it feels like a niche, but in actual fact, it should be something that is, you know, as obvious as learning how to go and cross a road, you know, something that we teach children, but also teach adults. I don't believe after this conversation that most adults appreciate the risks that are genuinely there. Particularly around alcohol, but also, you know, I don't think we're even thinking that way, that these are risky situations. And, you know, a lot of parents, if you were to speak with them, they would say, yes, I understand, but these risks are everywhere. And they're also risks because of our biases. Our attention can drop so quickly. And if we don't actually put in mitigators, you know, we can miss these, except these are obviously fatal misses potentially. And we haven't even, you know, touched on the non-fatal, but still, you know, life impacts that could incur from that because of, you know, resuscitated, but still, you know, ongoing difficulties. So thank you so much for taking the time today and for your work. You know, genuinely want to you know, say thank you for your contributions, for speaking to me and our audience today. It's a topic that we should not only, you know, think about, but talk with friends and you know, it doesn't matter what age. You know, our elderly, I had no idea, you know, you just don't think about these things and hence the importance of, you know, talking about this and making sure everyone at least starts to think in this way, and maybe some cultural change over time, in addition to, you know, some of these, whether it's legislative or you know, types of mitigating factors like you know, rules around how pools are fenced and the like. So yeah, thank you so much for your time and your work, and I hope that your ongoing contributions and research can also guide what this next you know, pool fence intervention can be, so we can reduce it, you know, again, you know, substantially, and particularly in the rural and river places, not taking away from, you know, continuing to work on the, you know, the beaches and the like, but it's important that we talk about it, you know, where it's going to have the most affect and you know, focus on that and you know, continue the work that we're already doing as well.
Absolutely. Thank you.